The HeelCheck by ASP Global is clinically designed to provide ultimate protection against patient heel pressure injuries. The HeelCheck offloading boot has a tapered foam wedge combined with soft pillow fiber. The heel lift system ensures continuous flotation of the patient's heel for treatment and prevention of a pressure point, which can lead to a pressure injury. Designed with plantar panels along the bottom of the foot, HeelCheck provides easy access to perform patient skin assessments and heel checks. HeelCheck is available in 3 sizes: small, standard, and bariatric. For proper fit, the appropriate size can be determined by measuring the circumference of the patient's calf with the included paper tape and referring to the HeelCheck sizing chart. Boot placement. The HeelCheck is conveniently designed with a numbered strap system for easy application. To begin the placement of the HeelCheck on the patient, first establish the proper orientation of the HeelCheck using the toes label and toe tag as a guide. Next, open all boot straps 1 through 4. For ease of use, fold and hook the Y straps 3 and 4 back onto themselves. Finally, completely open the HeelCheck, including the plantar panels. Gently position the patient's heel directly over the heel opening. Then, wrap the boot up and around the patient's foot and calf, ensuring the heel remains securely placed. Close the plantar panels at the bottom of the patient's foot and ensure the edges are properly aligned. Beginning with the lower strap, labeled with a 1, securely fasten the strap for a snug fit. This will keep the patient's foot positioned correctly inside the boot. Repeat for the top strap, labeled with a 2. Next, apply the Y straps in order, 3, then 4, to adjust the patient's foot to a neutral position. This will help ensure the patient's heel remains offloaded. Note that leaving the straps too loose increases the likelihood of the patient's heel repositioning inside the boot, potentially causing issues with heel offloading. When the HeelCheck is securely in place, reassure the patient's heel is in the hole, completely offloaded and fully floating above the bed by looking and feeling the hole under the boot. If not, undo the straps and reapply. The HeelCheck also reduces the likelihood of foot drop by keeping the foot at a 90-degree angle. Never allow the patient to walk or stand while wearing the HeelCheck. To remove, simply undo the straps in the reverse order, 4 to 1. Fully open the boot and remove the HeelCheck. Skin assessment. The HeelCheck is designed for an easy patient heel check. When performing a skin assessment, simply open the plantar panels to assess the patient's skin, check the patient's pulse and foot temperature. In accordance with the National Pressure Injury Advisory Panel guidelines, ASP Global recommends removing the HeelCheck every shift to perform a heel and leg skin assessment on the patient. Your facility's protocols should also always be followed. The HeelCheck has 4 sequential compression device tubing access ports. Never use the heel opening hole to route the sequential compression device tubes. This may add unwanted pressure to the skin. Wedge placement. An optional anti-rotational wedge is available to aid in the prevention of internal or external rotation of the patient's leg. The wedge can attach to either side of the boot to help prevent leg rotation. Attach the wedge by placing the hook and loop material on either side of the HeelCheck. Bring the strap underneath and connect to the opposite side to secure the wedge attachment. With the tapered foam wedge in place, the HeelCheck is designed to mimic the shape of the patient's calf and prevent hyperextension of the knee. Adding rolled blankets or pillows under the patient's knee may compromise the heel offloading position. As needed, the HeelCheck can be spot cleaned with an antiseptic wipe. To receive further cleaning guidelines for the HeelCheck, please contact your ASP Global representative. To find the best product for your patients, please call or visit our website.